Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel helping you to live your best life. Today's video is about exercise. I wanted to talk about exercise so I can give my patients a little background and a little bit of things that they can use to plan if they're going to try to implement exercise for lifestyle intervention. It's common for me to discuss diet before exercise or touch on diet a lot harder when I first visit with patients if they need to make changes in their metabolic health. I think that if we focus on diet, it's common for patients to have more energy, and then if they do experience success, more confidence with their abilities. When they have more confidence and more energy, it's going to be more likely that exercise will succeed. And I want to set my patients up for success, of course. If you compare diet and exercise in effectiveness, actually exercise will win out. If you compile studies together on longevity, you'll see that there's a 400% increase in longevity with regular exercise versus about 175% increase in longevity with better diet. So quite a difference there. The single most important factor, excluding all other variables, in preventing cognitive decline is exercise. So we can't understate the importance of exercise. You can measure a patient's fitness by measuring their abilities to do activities of daily living, such as getting off the floor, getting around in their home. You can also do functional weight tests, such as a farmer's carry with heavy weight, or you can have them do a dead hang from a bar to see how long they can hang there. Other testing for aerobic capacity includes VO2 max testing. A common goal for cardio workouts is 200 minutes per week, split up, of course, in multiple days. It's also common to hear about zone 2 cardio being very beneficial. Zone 2 cardio is when you are working out fairly hard, but you're able to carry on a conversation with those around you. If you push it just a little bit harder, you won't be able to carry on a conversation while you're exercising. If the majority of your workout is in zone 2, this will be probably the most beneficial for your cardiac benefit. There will be times when you go into zone 3 and 4, but just in general, keep that in mind. The goals of exercise should be to increase your stability, increase your strength, and also your aerobic and anaerobic capacity. Exercise has significant impact on longevity for many reasons. One of these reasons relates to bone health. If you think about women and osteoporosis risk, it's pretty significant. Women in their 20s are recommended to start lifting weights to help prevent this problem. Weight-bearing exercise seems to improve this. It's been studied to determine whether regular resistance training or powerlifting is better than the other. It appears that powerlifting is even more beneficial than regular resistance training. Of course, you need to have proper training yourself to powerlift correctly and avoid injury. Safety is always first concern. If you get deep into the exercise pathway, you'll find out there are a lot of different tricks as far as mental imagery, concentration, focus, actually imagining muscle fibers lengthening and shortening while you're doing the workouts. If you leverage your neural pathways, you'll get a better workout and your time will be well spent. One such trick is if you're doing bicep curls with individual dumbbells, squeeze the grips tightly on both sides and that will enhance the lift. There are many tricks like this. If you'd like to investigate them, they're out there. There's a gentleman by the name of Ben Bokikio who has been working with his clients to improve their metabolic health with resistance lifting for many, many years, and he has books out there as well. I have one of them. His premise is he would like his patients to lift heavy weights, very slow reps, and very low reps. He feels that this improves metabolic health and also improves strength at the same time. His protocol has patients working out only 15 to 30 minutes at a time, about 2 to 3 times a week. Of course, you would want to do other workouts on other days besides this, but it is a very time-condensed workout, and it's hard for patients to say they can't fit this in. My approach personally is a little bit different, although I include some of his precepts in my approach. I try to work out 6 or 7 days a week, actually. You don't have to follow the same protocol, but I'll just tell you what I do for my own purposes. On Monday, I try to have leg day using big muscles. This helps to burn calories as well as improve my glucose utilization. It also gets me started for the day. On that same day, I often do some cardio workup, Sometimes I do rowing, sometimes I do treadmill work. On Tuesday, I do chest and upper back. I also do some arms sometime, and I will focus heavier on the cardio that day. Sometimes I'll do high intensity interval training that day. On Wednesday, I will do biceps and triceps, as well as some cardio. I may do some lower intensity workout, not likely high intensity. On Thursday, I hit chest, back, and abdominal muscles, and I also do some cardio. On Friday, I try to do a high intensity interval training workout and also do some lifting, but it's usually minimal. Oftentimes it is in dips, pull-ups, or sometimes just planks or other flexibility type workouts. Saturday, I do a general overview and hit multiple muscle groups, sometimes not as hard as the rest of the week. And then Sunday, sometimes I will lift, but sometimes I'll just do a workout with a longer, kind of slower activity, walking, hiking type workout. You can choose what works best for your life. This is just what I try to do. If you are exercising regularly and you encounter the issue of you've had poor sleep for one night, you can still try to work out. Realize this may compromise your ability. A lot of your muscle recovery occurs when you're sleeping. If you are sick, then be very tuned to your body. If you don't have a fever and you just have some mild congestion, you may be able to work out and just minimally modify your workout. If you have a fever, severe cough, or shortness of breath, don't even work out. Let your body recover, let yourself heal. I've talked about this in other videos, but exercise is very powerful. It can certainly improve your longevity and your cognitive ability. It improves mood, decreases risk of depression and anxiety. Also, it actually improves your immune function due to endorphins and its effect on the endocannabinoid system. Not only that, you look better and feel better. It can improve your confidence level. I think exercise is crucial for longevity. I think we rely too much on medications, and I hope my patients will realize that I feel that this is very important. I hope this video can help my patients to have a basic outline about exercise. If you're very unfamiliar with exercise, you should always get help. Get a trainer. Avoid injury. Don't hurt yourself. If you're not my patient, you need to see your own doctor for diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life.